Hi, it's Dr. David Frederick from Integrative Mental Health Center. I want to share a patient testimonial with you today because I think this is kind of exciting. So I first saw this patient in June 2016. He was complaining of panic attacks, between 3 and 6 panic attacks every day that he managed with Xanax. The Xanax would help with the panic attacks, but he would still get the panic attacks, so he wanted something maybe that would hopefully prevent the panic attacks or at least decrease them. So the onset of his panic attacks and anxiety were 3 years previous to 2016. This was in 2013 when he found his father, who passed away unfortunately in a traumatic situation. And the patient did have a history of multiple physical events of trauma as well as emotional trauma events. And so what I first did is I wanted to make sure that there was nothing physical that was contributing to his anxiety or panic attacks. So I ran some blood labs, I did a physical exam, and then I talked to him, I asked him questions, and it did seem like it was definitely not, there was not any physical contribution to his painful symptoms. And so what I did next is I went through the DSM-IV, which is a book that clinicians and physicians use to diagnose and treat patients with mental health disorders. And what I ended up finding out was he was suffering from post-traumatic stress disorder. Part of his symptoms were he would have these intrusive thoughts where he would remember the scene when he found his father. He would actually, be a little bit disassociative, where he wasn't sure if this was real, if the physical world was real, or if the memory was real. And he had many thoughts and recollections about his father, specifically of the painful event. Somehow it was just stuck in his consciousness for the past 3 years. And he also had an increased startle response, like he would just jump, the slightest thing would scare him. The other serious thing, in addition to just feeling miserable and unhappy and anxious and having panic attacks for the past 3 years, was he was not able to get much sleep at night because he would be tired, he would go to bed, and then the second he went to go to sleep, he would start thinking about the past, about his father, about what it was like when he found his father. Just all these horrible thoughts that he kept thinking about. And so one of the homeopathic remedies I was considering has this symptom, and so it was on my radar. And the other thing that sort of pigeonholed it for me was he would be talking to me about these horrible experiences and memories, and it was very sad, very painful. And he'd be talking about it really sad, really upset, and then all of a sudden he would just start to laugh. And I thought that was interesting, so I went into my computer and I looked it up, and in fact it was the remedy that ended up putting him in remission for PTSD. It's called Natrum, and it's really good for people who have they're kind of stuck in painful thoughts and experiences of the past. For some reason they can't move back into the present, and then they also have a difficult time thinking about anything pleasant or just even mundane. And it also covers the symptoms of feeling restless when you try to go to sleep, so you can't go to sleep. And then it also has the curious symptom of when someone's really sad and then they just kind of laugh about it. Yeah, so it's been when I first saw this patient, this was again in June 2016. Now it's February 2018, and I haven't seen my patient in about 6 months, but I called him today and he said that he's doing well, he's back at work, he's no longer having panic attacks, doesn't take any Xanax, he can sleep well, he takes the homeopathic remedy maybe like once a week, maybe as needed, and he's kind of feels like he has his life back. So that was one of the most powerful things that I've seen homeopathy do for a patient in a while. So I wanted to share that with you, and I hope it gives you some hope. And I wish you well. And if you have any questions, you can give me a call at Integrative Mental Health Center in Scottsdale, Arizona. Our phone number is 480-426-8040. Again, I'm David Frederick, and I hope you have a great day. Thank you.